Hey everybody, today we have Dr. Hannah Spier with us all the way from Switzerland. You're in Zurich, I imagine. Is that right? Did I hear that right when we were talking?
Exactly.
Zurich.
Yes,
Okay.
I'm in
This is
Zurich.
this is cool for me and I'm very excited. I always like to talk with people internationally. I've been doing Naga Notes for a few years now and it started internationally in Cambodia by way of South Africa, and so I've gotten to meet people from all over the world. And it's been a while since I've spoken with somebody elsewhere. And for me, it's like my day's just getting going here Friday morning, but for you, it's dinner time. So I really appreciate you carving out the time to show up and do this. So thank you. It's
Thank you so
really an
much
honor.
for the invite. It's my pleasure.
Yeah, tell everybody a little bit about you and what you do beyond the credential of, MD
Yeah.
psychiatrist.
Right. Yeah. So, well, now I'm primarily a mom, actually. So I came down to Switzerland. I'm Norwegian, actually, Norwegian born and raised. And I met my husband online and then I moved down to Switzerland. So I sort of continued my psychiatric residency here. That was 10 years ago. And I was a very ambitious career woman. I was finished early with everything and and everyone encouraged me. I wanted to be head of a psychiatric department by the time I was 31. That was this very intent. That was this vision I had. I was very focused on titles and what I was going to wear.
We
And
all we all have been there, I think.
yeah, I thought this is so cool. And everyone around me thought it was really cool too. So I got that feedback and never questioned it, right? Because you had that was the reality was reflected.
Totally.
And yeah, and then so I even had a fight with my husband as I was pregnant because I thought it was so unfair that I'd have to take a break and he didn't. And it's funny because I mention that because so many women, friends, and patients have said exactly the same that this,
Yeah.
without unprovoked, they're saying how this is so unfair. This is the thing that's so unfair, and they can just simply go on unchanged, and you have to do this and you have to do that. And so, and then my daughter came. My daughter was born, and yeah, everything changed. And that's also something I hear from women all the time. I had kids, and I was completely unprepared. What is this? And it's this basic biological reality, this obvious truth that every woman before us could have prepared us for, yet nobody did. And so it's funny how and I was the same. I was like, what is this? I'm so focused on her. Suddenly nothing else mattered. I didn't want to go back to the hospital. Being away from her was agony. So after I took that, ended up taking maternity leave for 7 months. And then went back and I didn't want to go back. I thought it was horrible. And then instead of, I'd been this ambitious career woman and suddenly I'm sitting in the bathroom in the hospital crying with my phone and looking at pictures. So that's when I decided I wanted to just be with my kid and just I took her out of daycare and I became a stay-at-home mom. And I did that for a little bit and then I saw what was going on. I changed my views on a lot of things. I became a conservative. Just I just read and read and read and listened in this time where I was with her, and just okay. There's so much we haven't been told. There are so many lies out there, and especially in the field of psychiatry. And I was also then continuing. So here in Zurich, I took a psychotherapy degree. So I'm also a cognitive behavioral therapist. So I did that for 3 years at the university. And so I continued that. And then I would start voicing these newfound views, which were completely counter to everything that we were being taught, everything we'd had been taught, and the reaction just completely confirmed that this ideological capture of psychology and psychiatry that I then started writing about, because I found too few people were. And everyone was just going along, just completely blindsided. And the people I worked with, they were all, these 30-something-year-old single women with no other plans for the future than the same as I had, becoming this and becoming that and focus on self, self, self. And I just thought these are the people who are treating patients. And so that's when I started writing and having this Substack. That was never the plan. I just, I was just yelling at home at nothing. And my husband was like, "Can you please just start writing? Because I can't listen to this anymore." I just, and poor thing. So that was a good outlet. And then that actually became something. The Substack really took off. I don't think, yeah, I can't believe what's happened in the meantime. So that was the answer to that. I think.
Yeah. How old's your daughter now?
She's 7.
Wow.
She's
Okay.
7. I had two more. I have a 5-year-old and a 3-year-old. So a daughter and then two boys, two rowdy boys.
Yeah. Answered my next question. I have two boys
Yeah.
also, 10 and 8. Um, so are you practicing?
Yes, I have patients on the side. Many I had from before, so that they never, they didn't want to, they didn't want to change. They liked having an English speaker. So I have continued privately, but very, very little and really only on the side as a side gig. So I turned it around, right? Instead of being a mom as a side gig, I now do therapy and writing as a side gig.
Yeah, that's a really important distinction I think you make. So let's get into it here. You call yourself the anti-feminist psychiatrist, and I think we ought to probably define some terms here, like what is feminism? We mentioned you became a conservative. What does conservative mean? And why is it important that people like you and me and I don't know if you've met him yet, but Ryan Rogers has a really wonderful podcast called Reality Therapy, and there's several others in this space who are trying to return counseling, the psychology profession, psychiatry broadly, to its roots, which is to help people change, not just simply keep them where they are, less miserable, right? We'll call
Just
it that, I guess.
affirming them.
Yeah. Affirming care started with this gender movement, but it's rippled into so many other illnesses where we're just not allowed to like confront people anymore. So talk a little bit about your experience. What I mean, you breezed over the I guess the reasons behind the metamorphosis, but help the listening audience, lay people who may be curious, what the heck is going on in our profession, and what have you seen from across the pond, as they say, in your world? Because I
Right.
know how it looks in the U.S., but now I'm seeing it's becoming global and it's really rippling into the global South too, as I've found out recently.
Yeah, I mean, I think it's a Western problem.
Yeah,
It's a problem of the modern West because it looked exactly the same in Norway. I also lived in Germany, looks exactly the same. I speak to German colleagues as well, in
interesting.
Netherlands as well, and being translated to Dutch, it looks exactly the same there. And I'm speaking to you guys all the time, right? So I do
Yeah.
think that this is a modern Western problem.
Yeah, what is the
And
problem?
this
What is going on here?
Right. So, well, I call myself the anti-feminist psychiatrist because I went into psychiatry because I really loved forensic psychiatry. And so that's where I started out, right? I wanted to work with schizophrenics and psychosis and bipolar 1. And then my husband says that's off the table. I'm not allowed to do that again. If I was ever going to actually go back to a clinic job, that's what I would want to do. But so what we end up doing, and I think that's true for you too, we end up working with women who are anxious and depressed because they're just that's our bread and butter, really. And so I did that mostly, and I just saw that these women had been lied to, as I was lied to, and we're sort of indoctrinated in all these different beliefs that at some point in our lives, and it's kind of age specific, will lead to some sort of psychopathology, right? I'm talking about anxiety, depression, or burnout. And I saw all these girls in their 20s and they came in with like sudden onset anxiety attack, panic out of nowhere. And they've been forced into all these degrees that they had absolutely no interest in or the capacity to finish, and they were having panic attacks. They had unmet attachment needs. They were dating all the time, didn't know why, and other therapists, because as a psychiatrist, usually the second or third one they see, right? That's not so. So I would always be reading what they'd done before, and they would always be taught, or say, yeah, we need to teach you to learn to be alone. And I think if you're
Oh my
listening, that's
goodness.
something that you hear as well. Your problem is that you need men. Your problem is that you need to learn to be happy by yourself before you can be happy with someone else. And you go on to Psychology Today, go on to any psych blog, like, that's what you're going to be reading.
That's
How to
hugely
learn to be
popular. Yeah,
happy by
yeah,
yourself. Yeah.
yeah.
So, and and that's wrong. We're not, I'm sorry, we are not meant to be as women single well into our late 20s. That's not what we're primed to do. So obviously, we're going to have that's going to have consequences. And just saying that not ha that going around with unmet attachment needs as a woman in your 20s has consequences that can get you fired. That gets you into
Yeah.
trouble.
Well, you
Yeah.
sound like a heretic
Um,
right now talking like that because that goes against the cultural narrative that we've had for what 50, 60 years now. Like the career
exactly.
woman, Miss Independent. I mean, there's songs about it, there's movies about it. Like it's everywhere.
It is. And it's such a dangerous lie. And we also, from girls are small, we never teach them to see men's perspective. We teach them to misunderstand men. We teach them that the things that are natural to men, they're actually to be frowned upon, like healthy competition, like ambition. And then we go on to teach them that the only way they can succeed is some sort of strange male version of that, like wanting to be a head of department by the age of 31. Like, what an obscene plan that is, really.
Right.
All you want is your body is telling you something completely different. And what do we say? You need to suppress that. It's not healthy. In which other context in psychology do we actively tell patients to suppress a biological reality? We've known for ages that suppression is
Well,
bad.
well,
Yeah. Okay.
well, these days.
There are more and more. Yeah, exactly. Now there are more and more. But you have a widow comes to you, and she wants help with her grief. You're not going to tell her, actually, I think you're depressed for a entirely different reason. You're
Yeah.
not gonna. But that's what we do to women. We tell them, no, you don't want a family. You need to learn to be happy by yourself.
You know, I
Yeah.
I I agree with this. Okay, so this is something that I've had to change my mind around in recent years because I, like you, like our mutual friend Joshua Slocum, like so many other people who have changed their minds, we used to believe this stuff. It was success in the workplace over everything else, right? We measure ourselves by our titles and our degrees and our metric performances and all this stuff for performance metrics, and at the expense of natural human growth, the community, the family, the child rearing, like all that stuff. We've been programmed to believe that that's somehow abnormal or unnatural. It's like, well, if it were, society would have ceased to exist many, many thousands of years ago. So we got here
Yeah.
because of these
Yeah.
innate internal drives, right? So to
Yeah.
connect and to be with other people. And so I know my own journey in having to question this. It came with immense pressure, loss of peer colleagues, mutual friends, that kind of thing. That just is like, oh, you're just not getting it. You're too conservative. You're ultra right MAGA or whatever. It's like, I don't know. I kind of like my family. Um,
Yeah.
but here's what I wanted to ask. You're centering on women, and there's nothing wrong with that because I think women absolutely are suffering. I know we have literature that supports this, but also my anecdotes are the women who are comfortable in their role as family woman first and career woman second seem to be inordinately happier than those who have those roles inverted. But I want to
Absolutely.
ask
Yeah.
this. Aren't we doing something similar to the men by saying that the very drives that motivate them are quote unquote toxic or whatnot? Like, don't we have a yin
Absolutely.
and a yang going on here where
Yeah.
we're destroying both femininity and masculinity?
Absolutely. And I think we see that in the numbers as well. I mean, burnout and suicide among men have risen, and we've
Yep.
completely taken men's roles. What are they supposed to do? And fathers are shushed in their own homes. They're completely because our whole parenting techniques now is governed by femininity, empathy and understanding first. And God forbid you raise your voice. And so if I see fathers are quite physically diminished. If you look, I mean, I look at around in my environment and I see moms are getting bigger and bigger, and the fathers are physically getting skinnier and skinnier. And I
That's
do think
fascinating.
that reflects a little bit what's going on in the home. They don't know what to, they have to continue making money because they know she won't respect or like me anymore if I earn less than her. And the data supports that. The divorce rates are higher in the cases where not just does he have to earn more, he has to earn significantly more for the divorce rate to not be unfavorable.
Oh,
And I
well,
think the
I'll
man
speak.
knows that.
I'll speak to my own
Mhm.
marriage. For 12 of our 14 years we've been married, I've been the not the breadwinner, so I am apparently comfortable in that role. But please go on. Sorry, let me not interrupt you too much.
Yeah, no, that's just the stats, right? So of course you can compensate for that, but you have to be aware. You have to talk about it, and that's something we also suppress. And the women are allowed to take as much space as they want. So if you t talk evolutionary terms, we're the man is supposed to have his bat and guard the cave, right? Because we're going to be vulnerable. We're going to need him outside of that cave with his bat. And now we're coming out. We're saying we can do this too. Taking the bat, you can do whatever you want.
Yep.
So of course he's not doing well, and we see a lot of burnouts among men. I worked with a lot of men in the clinic. Also came in the middle of their 40s with anxiety, with panic attacks. They couldn't travel anymore, and therapy is very feminized. We don't know how to really treat men or do for them what they need, right? They need to heal through doing, through action. They don't want to sit opposite a woman or even opposite a man face to face because that ignites them. That's how you do sport. You look at any sport, they're face to face. That it's not what's it called? Yeah, it inspires not aggression, but it sort of is oppositional in men.
Yeah. Yeah, keep
So
going.
you should
This is new
go.
to me.
Men talk in cars. They talk side by side in cars. That's what you
Yes,
should
and
know
on
if you have a
fishing boats
teenage boy.
and yep.
Exactly. You want to go out. You want to go for a walk. I didn't know. I never saw any therapists go out for a walk with their patients, or at least not women. They like to sit and talk and stare at each other over coffee. So the whole therapy thing is tailored to women and men. So I would tell these men to go and like build whatever you have at home. One built like he had his father's old boat and he built that boat, and like that was healing through action, not talking. But they're told that they're insufficient if they're not able to put everything into words. If they're not able to, the goal is to have them start crying, which you also see on television. Right? It's always a strong man, and then he has his redemption arc if he suddenly starts crying. Then that character is round and whole.
Yeah, yeah.
Right? That's what we're told. So obviously the female therapist sitting there, it's like, we had a huge breakthrough. He finally started crying.
Yeah, you're right.
Like
No,
these poor
that's so true.
men.
That's so
Yeah.
true. I'm thinking now, like, I think I have good rapport with my male patients, face to face, but is that the best way? And it probably is not. We probably really need to rethink this, or at least make it an invitation. Like, hey, do you want to do this, face to face, staring at each other in the office, or would you like to go take a walk or throw a football or whatever it may be, right?
Yeah,
I,
or
I think we're gonna have to
cards, bring
rethink this.
cards or do
Yep.
something, whatever. Like
Chess. Yeah.
just sit and play something. You have those I used to have those sticks. What are they called?
Pick up
I don't
sticks.
even remember the German name for this. Like you pick out sticks and it's the tower isn't supposed to fall like this thing.
Oh yeah, Jenga.
That
Yeah.
was really, yeah, exactly. That was really good. But yeah, so men are suffering a lot too. To boys in school, obviously, and but I think I focus on women also because that's what people want to listen to. The moment you put the focus on men, it's deaf ears.
Yeah. Yeah.
Deaf
Yeah.
ears, and I mean, the media won't even cover events that are solely about raising awareness for suicide epidemic among men. They won't
Yeah.
even come. So that's why it's okay. I want to fix this thing where we call feminism. I think that I really think it's a pathogen that we have to get rid of in
How,
every
how do we
context.
do this? Like, okay, as therapists or as lay people listening who are just curious, like therapy adjacent folks who are like, well,
Yeah.
okay, what do I do in my own life? Certainly listening to your instincts would probably be a good one, but how do you even know what your instincts are when you've been lied to for so long by culture and society? What can we do?
Yeah. I started by listening to Janice Fiamengo and just learning about feminism because we think that feminism was this benign movement just installed so that women would have better life and voting rights and all that. That's just how it's marketed. It started in the 1800s, and already then in the writings you see it's pathologizing men, infantilizing men, and it's this hatred of men in their own class. Not, because these feminists, they were privileged upper class, and they just hated their brothers and their fathers. They had terrible lives, very often completely traumatized, and they didn't have those personalities that longed for motherhood. So they had horrible stories, and they just wanted to apply that to all women. That the problem is that women don't have this and women don't have that, and men are taking it from them. And that's how it continued. And they wanted from the start in the 1800s to break down the family. They saw family as an oppression of women. You have the famous, Betty Friedan statement that the marriage is a concentration camp for women. And I mean, it's all versions of that the home is somehow oppressive. And we use that in our language now. This why do you call it stay at home mom? Like there are all these different kinds of moms, all equally valid. You can't just say, and I try. I don't like to say, if we're at dinner parties or something, which we are not, I don't say anymore that I'm a doctor, I'm a psychiatrist or anything. I just say I'm a mother, and immediately backs turn.
Yeah.
Nobody's interested
Yeah, you
anymore.
don't have any worth, right?
Yeah, yeah, yeah. But you can't say that. You can't just say I'm a mother. You have to be a stay-at-home, like you're lazy. Like what does that tell you? I'm a stay-at-home mother. It says I'm not really contributing.
Well, and also what it
Mm.
says is that I have to have a title to this, right? It's like I'm a big I just talked about a lot of this stuff yesterday on a on Ryan Rogers' men's mental health podcast. We had a panel of men, and the I am statements in Western culture sound very permanent, right? Like I am characterological trait is what follows, right? I am an accountant. I am psychiatrist. I am mom. So it's like you have to add the stay at home in there because it adds a verb to the mom. It's like a title or something. It's very weird. Um, but yeah,
No, no, but you
there's no.
can't say that. You can't say I'm a mom, right? It has to
That's
be
what I mean.
something
Yeah,
that has value. Yeah,
yeah, it
you
sounds
can. I have no
unidimensional
problem with I am statements, right? I am a religious woman. I am a daughter. I am a mother.
because you
That's
could be all
that's completely
things.
fine.
Yeah, yeah,
Yeah,
yeah,
but that's not. That's your identity is that. But we think that identity is what we feel in the moment, right?
yeah,
That's why we
yeah,
can
yeah,
define it every day.
yeah.
But no, identity is who are you to other people, and that's a mom and a daughter and a wife and a brother, etc., which are fine I ams. But somehow people, we have such a fragile sense of selves now, such fragile identities because we build it on the wrong things,
Right.
on bad values. I think
Or in
that's what
fleeting
you're
values.
referring to.
Yeah.
Exactly. And this therapy speak, the therapy language, it's replaced religious language. So like, and that's it's a house of cards. And so that's why you see that you have one label, and then 1 year later you have two labels, and then you have three labels. It's like a drug. You just can't stop.
And none of them mean anything except as you define it, which is a nice tack into talking about a lot of what you do, which is looking at narcissism and cluster B personality disorders and how they manipulate and coerce other people into their own
Yeah.
worldview. And that's actual toxicity. Before we get into that though, I'm curious, what's your training like psychiatrically? Do you have modality that you follow or multiple modalities? Because you're in Switzerland. I'm a big Carl Jung fan.
Oh yeah, no, no. Yes, of course. I mean, we are very fanatical about Carl Jung, and I did. I mean, but no, I'm not a Jungian. I think that's all great in theory, and it was amazing. He was an amazing writer, and I did read him when I learned German. I was like, oh, look, I'm reading him in a regional language, and like it's amazing.
Yeah.
But I don't think that it's not great in practice. I have to be honest. All the animist shadow work, not a fan. So just classic cognitive behavioral therapy, and even that I feel has its severe limits.
Oh, yeah, yeah, sure.
Severe limits. I think that therapy should be all about attachment. I think that it's really just about the person sitting opposite you and your connection to that person and what they can make you change. Can they inspire you to change? And too often the answer to that is no. And then you can just pack up and go home. Like, honestly, I've become so disillusioned.
Go
I
on
mean,
with
even
that. I
this
want to hear more
whole,
about that. What do you mean?
I mean, because so much of what I've seen is the result of attachment disorders, right? In girls, cluster B, it's all about attachment disorders, these depressions, these anxieties. If you are, because girls, women, now adult women, they were raised with mothers outside of the home. We are outsourcing and have been outsourcing so much of parenting for decades. And we cannot do that without it resulting in attachment disorder. So people come, but we like to touch on that before AI and the threat. I don't think it's a threat because people want attachment. That's why they stay in therapy for years. Right? That's what Psychobabble started at. I'm like, people are stuck in therapy for way longer than they should and they need to. And it's, because they have that attachment that they
Well, and the
should have. We
therapists
used
too,
to have
right?
that. Yes, it's these pseudo friendships, and they never let them go. So I do this thing with the sort of red flags in therapy, red flags. If your therapist isn't the one suggesting to you that perhaps we try 2 weeks between sessions instead of one, then you should go because that's a therapist who's forming a sort of pseudo friendship with you and isn't her goal isn't that you eventually don't need them. It
I
is,
mean,
and
from your
there's
lips
people
to
who know
God's
that.
ears, I tell you, at Zephyr, we are iconoclastic and a little unorthodox. We have a successful discharge calendar that I have taped in our front hallway. One page for every month of the year. We're supposed to write our initials and the patient's initials on the date that we discharge them, because it sends a meta message to us that you're not going to be here forever, and we're going to do deep work so that you heal and never come back. Like that's the whole idea. We don't do this
Yeah,
man behind the curtain pulling levers on your psyche stuff. It's like I want to teach you exactly what's going on so that you are equipped with the tools to solve your problems down the road, and we create sustainable change. And I
yeah, yeah,
reject the idea of therapy in perpetuity. And that's not to say that people can't need therapy longer for deep impacted, conditions or whatever, but like there's
of
got to be an
course.
end. There has to be an off
Yeah.
ramp.
And
Thank
that's
you.
why yeah, it's great. I mean, that's why the first thing I do when someone comes in is like we define a goal. What is your goal by
What do
being
you want?
here?
Yep.
Yeah,
And
exactly.
how will
Because
we know
that's,
when we
it's
get
this
there?
sort of otherwise you will never know. It cannot be just I am autistic and I'm here forever. That's not but
Well,
that's what they want now. They
well, and
want that
and and
affirmation from
yeah, and let's walk that out. I mean, let's say, okay, you just made an I am statement, Miss Patient of mine, right? I am autistic. Okay, well then, if that's your characterological being, what's my role? You hired me to do something, right? Do you want to change that autistic trait, or you just told me that that's all that you are, and you can't change? So what is my role? What are you hiring me to do?
Right.
Um, that falls in on itself, with therapy
Yeah, but
to
my
substantiate
impression,
your illness.
yeah, what they want is they want to sit there and they want you to help them manage the stupid reactions of other people.
Yes, yes. Okay, let's
That's
talk
what they
about one
want
of your
from that
articles.
therapy. It's this sort of the world is so mean to me, and how can I best handle this victim position that I have placed myself
Right,
in? Right?
right.
I want strokes from someone that I become attached to.
Yes, yes. In a pseudo mutual way. It's not a real
Yeah,
friendship. You're paying me to be there, and we're billing insurance or
ex
whatever we're doing, right? That's not a
exactly.
Yeah.
And I just saw that, I saw so many times how this, and it's, so it's the same sort of baseline psychopathology that's why I talk so much about cluster B. And I do think most of the women, I'm going to make that some most, not all, most of the women who come and say, "Oh, I have this autism," like they have some sort of cluster B constellation, and so there's that attachment disturbance. And what I saw, they might have come in with, "I am autist," or "I am ADHD, God help me,"
Yeah.
or I have anxieties, or I am traumatized, not I have PTSD, I am traumatized, or one of those things. But the moment I would leave, like on honeymoon or something, they would completely break down. And that is the sign that this is about attachment and not what's being done in therapy. I
Yes.
could write
Yes.
pages long for the substitute, because I went on maternity leave and I had just breakdown after breakdown after breakdown with these women, and they would have different labels, but they would have that baseline pathology of attachment disorder, and they were so attached to me. So that was one of those, eye-opening moments, that I could not get out because they were hanging onto my throat, like
Yeah.
physically, touching me. And you'd see this with the moment I got pregnant. That was when it would start, because it's a threat. So they would react very negatively
Hmm.
to this pregnancy because it means you're going to leave. And that's the problem with therapy. Back to the problems with therapy. You are bound to leave in maternity leave. Most of us are women, 80%, 85%. Or we are relocated, or we just don't like that job anymore, or we're being bullied at work. I mean, we leave. There's such a high turnover, or we retire. So it's just inevitable. And this is what we used to get in religious communities. It used to be our pastor or our rabbi or something. And now I've talked to these clergy people, and they're just like, "Oh no, it's mental health. We don't want to touch it." And I'm
Mm.
just like, guys, this that is not helpful.
Yeah.
It's that they just send them across the street. It's mental,
Well,
it's
we're all
suicidality. We can't touch
outsourcing
it.
everything at this point, right? Like
Yeah.
the priests and pastors and clergy are outsourcing what used to be handled by them to us.
Mm-hmm.
We as humans in our own lives are outsourcing our parenting to the schools or the daycares. The professionals are outsourcing
Mm-hmm.
our attachments to the patients. The patients are outsourcing their self-healing to the professional. I mean, like, wow,
Yeah.
it's just like,
Yeah, that's true. That's true. And so no wonder the patients are religious about it, because
yeah.
we are too, and we prescribe all these sort of spiritual. Oh God, I read an article today on psychology. When I need rage fuel, I go to Psychology Today. and, and I'm just like, what can make me the most upset? And there was this psychology PhD talking about spiritual intelligence, and I thought I was going to vomit.
It's all
And it's
clickbait.
just, yeah, but these people have
Yeah.
PhDs. These are serious people in the
No, they're
field,
unserious
and
people that are taken seriously is the problem.
that is the problem. So, because you asked me what is the problem that I see in therapy, and there's just so many things, and that's just one of them, that they're talking religiously about something that should just be, come in, we'll talk about coping strategies. Let's get you what you need for the pillars of mental health you need. And this should not be controversial, but it is. You need a family, you need a couple of kids, you need religion, and it could be, so they're honest about you needing spirituality. That's why they're talking about nonsense like spiritual intelligence. So if you don't have a Judeo-Christian religion, then you go and you seek, they do yoga, they do meditation, they put the word holistic in front of everything. So in some way you are getting that religious experience, and you need some hobby, and then you need content. And that's why I've seen so many people, they don't have content. They're secular. I know, because we live in a very sort of affluent urban area. Right? People are super well educated. It's Zurich, it's a finance hub, so it's all expats and all the very non-religious. They all some have one or two PhDs. It's terrible. It's terrible. But so they just they have no content. They maybe have
There's
one
no depth.
child.
Yeah.
And they're just talking about traveling and they're just getting more and more burnt out and depressed with time. So these are the things that you need, and it shouldn't be controversial to say that. And that's what you should be working on in therapy, slowly but steadily building up those pillars. But we're only focusing on the one, and that's the self-interest hobby part. And that is the least important part because if you have the others, that hobby thing is going to become smaller and smaller. It's going to be sort of, I mean, hobbies. What do I do now? I take my kids to football practice and dance practice. Like that's my hobbies. I go, right? You know this.
Yeah. Yep.
It's just, you're
Yep.
just not that important anymore. Someone think, yo, okay, I used to play piano, I used to play clarinet and all these things. Like that's not, I don't need that anymore.
That's not popular. We can't talk about that because it's like
Hmm.
me time and you time and self-care, and it's all so narcissistic, and we don't even know it. We just absorb this like osmotically from culture and society because they're all selling things, right? They're all selling whatever it is that they're pitching, and and we just don't even bother to question it. And I think you touch on a good point of like, my hobbies are now my kids' hobbies because I diminish myself in deference to my children, right? And that's
Hmm.
fine. We want to make sure the couple unit is intact because parents first, kids second. But this whole like me, you do you, separate and apart from the family, I need me time. It's like, why are you not drawing energy from the creatures you brought into into the world? Like, aren't you taking joy from that? That seems weird to me. Um, yeah, so
Yeah.
I don't know. Now that we're getting
That's,
ranty and stabby, to recenter
sorry.
this a little
Yeah,
bit,
it's my
I think the point is like
chaotic.
if you want to if you want to do good therapy and you're a therapist, be targeted with what you're doing with your patients. If you want to have good therapeutic experiences, go in knowing what you need to fix. And yeah, and that's okay if you
Hmm.
don't know, but then the therapist should probably help direct you. This whole like non-directive petting, stroking therapist thing is for the birds too. I did want to ask you though, because you mentioned the attachments and the religiosity of the therapeutic relationship. There's a canard out there. There's this trope that we've been told because research backs it, quote unquote, that the therapeutic relationship is the most important predictor of whether or not you'll be successful, right? So what I'm hearing from you, and I agree, which is we can't create a dependence. That's
Yeah.
unethical. And yet it flies directly in the face of this thing called therapeutic rapport, where it's like, if you don't click with your therapist, just keep shopping. It's like, well, that's
Yeah.
functionally not even possible in our world in the United States where we're billing managed care for it because they only allow one intake per year or something. So like somebody's not getting paid for that. So instead we do a 15-minute consultation for free to see if you click. Speak to
Yeah.
that a little bit if you would, please,
Really?
because
You do?
that's the steel man argument is like, no, 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 you have to have therapeutic rapport, and therefore don't abandon your patient if you go on maternity leave. Like
Right,
if they're
exactly.
verklempt because you leave, then you've broken their trust or some stupid crap. So talk a little bit about that if you would. How do we fight back
Uh,
against this weirdness?
this weirdness, yeah. Uh-huh. This therapy, where to start?
Built-in dependence.
Whereas I just find regarding because we were also taught that at the university. They would tell us what's because we would come in, we would separate, so we were the cognitive behavioral therapists, and then there would be a group with psychoanalytic ones. We had a Freudian line, and they would all look the same. By the way, they would all have the beards and the glasses.
That's hilarious.
And yeah, then we were
That's
just like,
really funny. 'Cause
and they
I
never
love
understood
psychoanalytic, but
anything.
I'm not going to
Yeah,
dress like Freud.
they were so high. They were such fart sniffers, and then they would never understand the concepts that they were just taught, and they would just be high on all these terms. Then they would
I'm
just, and
sorry.
I would all,
Did you say fart sniffers?
yeah, from that South Park episode, where they're just going
Oh,
around and
I
just
know.
sorry, there's just no
Oh,
better
okay.
way. And I would always like to sort of stir a little bit, so I would just go, I'm so interested in that. What does that mean? Because we would then question each other, and there was just no way. It was so funny every time. And then the family therapists they were child psychiatrists, so they had to deal with family. Anyways, we'd come together, and the the conclusion would always be, what is the most important thing? It's Beziehung, 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 relationship, relationship, relationship. So we are all different and we're all learning different things, but relationship, that is the most important. And then I always found that I would always have a patient clicking with me if I would just be completely stroking, completely overly empathetic and um just completely affirm their victimhood. The more I would affirm their victimhood, the more they would feel the click. The moment I would start talking about accountability or responsibility or, trying to sort of see things in a different way or, okay, what evidence do we have for this belief? There would be less clicking. So
Yeah,
you can
yeah,
sell, you can be
because you
fake,
offended them.
and you can, yeah, and there are so many therapists who are just interested in having patients stay for a long time, having lots of patients, and all of their patients would be clicking. And you should be talking about taking responsibility and being accountable to your own actions in the world. That's what therapy should be about. And that's when we're talking about coping strategies. And so that's what that is. A coping
Yeah, but
strategy
that's
is like,
that's
what
not
can
good for
I
the
do in the
ego.
moment?
It doesn't
It's
fluff the
not good
ego
to,
to
but the
graduate
more
people.
ego stroking you do, the more relationship you're building. And it's fun. This also, they like to talk about therapy, and we are taught, you too as well. They're talking about therapy as if it was surgery. Right? That all these minute things and the count and the transference and oh, go the transference and the counter transference. And it's just like, you know what? Transference, if you are working with transference, counter transference, the data suggests that it's very well supported. Actually, they found this out in the 1994. Grave came out and with research on this that it's negatively correlated. So you're much more likely to do damage with your transference, countertransference work than you are to do good. It's only if you really, really, really know what you're doing, if you are hyper competent and not, you know, if, if you know the person really, really, really well, then perhaps you can use it. But if you work in that space, you're much more likely to offend the patient by mirroring and working. Oh, now I feel that that's transference, right? I'm guessing you're working with
Yeah, no,
that,
no, no,
and your
no. The
audience
quizzical
knows
look you can
what
see on
this
my
is.
face. Yeah, no, the quizzical look you see on my face probably is not that I don't understand it. It's that I th let me frame this up. My graduate education, and this is pretty harmonious across all graduate education I've seen for the last 12 or 15 years, is they tell the students to be aware of transference and countertransference. And for the listening audience, by the way, transference is when the patient projects or sees into something in the therapist that reminds them of themselves or something in their life. Countertransference is when the therapist does it with the patient. Patient walks in, looks like your mother, and all of a sudden you're just like reminded of your mother, and you
Yeah.
can't get out of that loop, right? So what we're taught is be aware of it and really don't just park it, put it to the side. If you really want to call it into the session, you can make them aware of it, which I think is what you're talking about. But we were never taught to work with it. So this is news to me. Working
Hmm.
with it, man, you're
But it's
right, because
also
that's a
the
bold step. There's a
reactions.
bold assumption
Yeah.
there, right?
Yeah, it's also the reactions that occur in therapy
Yeah,
because
yeah,
of
yeah.
the
Like the
transfer, right?
emotional,
So it's
yeah, yeah, yeah.
exactly. So it's this, I'm feeling this right now. So could this be because you're being a complete jerk?
Yes, yes. And I wonder where
So
else in your
putting it
life you
very
might be
sort
a
of
complete
simply,
jerk. And yeah,
exactly.
yeah,
And this is, and so therapists do, and they think they're being so, because they're taught therapy is like a surgical thing, right? Because we want to, psychiatry and psychology, they want to be just another discipline of medicine when it
yeah.
suits them, right?
Yeah, oh, you're right,
That
right,
is
right, right.
right,
Yes, that's
exactly.
yeah,
And so when you read about this, it's like it's an exact science. And then you do, and when they say this, and then you should do that. So a lot of people think that as a psychologist or any therapist, it's about which words you choose in the moment and having this you're just waiting for that clever feedback, right? That clever sentence, and then
yeah.
it says click, and then you unlock that memory from your childhood and you're healed.
Yeah.
which
Well,
is
that's how it's
absolute
framed in TV
bollocks.
too. Yeah.
Exactly. So that's what people said. So that's where when I would be shouting at the television, and my husband said, "Please shut up.
You
Just
need to start
please
writing.
just write it here." Exactly. But that, because that's been debunked a long time ago. This repressed memories. It's an
Yeah.
unfalsifiable hypothesis. How am I going to prove that you don't have a repressed memory?
Yeah, yeah.
So
Well, and
it's
say nothing of
absolutely
the replication crisis.
unscientific. Yeah, it's completely unscientific. And so anyone can sit there, and that's what we have now sit with all these 20-something-year-olds and the 30-something-year-old women who are devastated and childless, just they thought it was something else. And, we would tell them that, it's probably because of your parents' divorce when you were 16. And, it's probably some of these memories that you've traumatized. You just don't know that you're traumatized. And so we're just sorry, I digressed again. We're talking about
No,
transference
no, no,
and the
that's no, that's fine.
relationship.
I wanted
Um,
to shift gears into your writings
yeah.
anyway, and you alluded to one, and that's not the one I want to talk about, which is that not all the women who present are traumatized like we want them to be. But what I wanted to ask you is this one about ADHD is the what'd you call it? The illness that never was or something like that. It's the point is
Yes.
ADHD is fake. And I don't know if you're aware of Mark L. Ruffalo from Florida. He
Yes.
teaches psychiatry programs down in University of Central Florida. He's brilliant. Uh, he's really got good posts on LinkedIn and Substack also. But we were talking about the DSM and the evolution of the DSM and how the the diagnostics that we have, the actual like codable diagnoses, many of them are illegitimate. They're not valid because they're a
Hmm.
construct. And then we tried to create criteria to make the construct real. But what we
Hmm.
ended up doing was creating a comorbidity crisis because what can be explained by something is already explained by something else. And so we've got too many diagnoses. ADHD is one of those, is the point. And it happens to, for the people who don't know, it happens to have the longest list of rule outs in that chapter. It's like 3 pages worth of, hey, before you diagnose ADHD, make sure it's not this, or this other thing. And then maybe you have it. So, but yeah, what's the most popular exploding diagnosis in the world? ADHD. So tell us, Dr.
ADHD.
Speer,
Exactly.
why
It's
is this
just
the
awful.
diagnosis that never was?
Yeah. So exactly. My problem with ADHD is that we're trying to attribute it all these medical terms. So we're saying now that ADHD is genetic. We're saying that ADHD is a neurodevelopmental disorder. And like you go on Wikipedia and that's like the first thing it says,
Well, that's the
like a
chapter that it's
petulant
in.
teenager. It's like
Yeah.
it is a neurodevelopmental disorder. Right? It's a
I'm neurodivergent.
and then like screaming it loudly enough makes it true. Yeah. And the problem is that we have not been able to prove that it has a very strong genetic link. It's like weak polygenic scores at best. And still, we're selling it as this genetic, because you don't have mothers coming in, and this was 10 years ago, saying my son was just diagnosed, so I
Yeah.
probably have it
And
too.
usually by the school counselor, right? You,
Exactly.
yeah, it's somebody
And then
without a
and then they
a
go on
license.
to yes. Yeah, no, also psychiatrists, psychologists as well. But so I don't think they support each other. I so because they have to get a report from the teachers, and the teachers, of course, they have too much. They have all these undisciplined kids now. Discipline is nowhere to be seen. So of course the teachers are like, oh God, pray, okay, if we just had, ooh, with the Ritalin it gets better, and nobody knows that the Ritalin it's a psychostimulant. That's sort of been, it's never been properly advertised what Ritalin really is. It used to be in the
It's amphetamine.
Panzerschokolade, in the thing that they gave to the soldiers. To exactly. And they saw that, oh, afterwards, these soldiers were addicted. They had horrible hangovers, like all these. And that's the same thing as we're giving the kids. But of course, it makes everyone's life much easier.
Yeah, just drug
And
them into
so, but
compliance.
we're now also exactly. And and then so we try to pack a neurobiological aspect on this as well. They're really trying so desperate. It's the most researched thing in child psychiatry, the most researched topic. They're trying so hard to pin it on some biological model because that would justify it, right? That would take the um, the focus away from what they have so obviously done in schools, and everyone sees it and everyone's talking about it. Hey, I think it's the school system that, especially for young boys, they're not meant to sit in front of an 8 hours a day, and this is not natural. They should be out. And we're also seeing that, okay, you take the child from a normal school to a Montessori school or a Steiner school, you call it Waldorf schools, the symptoms almost disappear. We have data on that. Okay, so what do? We pack it into a biological model. The problem is that the evidence just has not come out. The evidence is not there. You have weak polygenic genetic scores at best. And what really irks me is neurological, the neuroimaging. Right? Psychiatrists are all about the neuroimaging. They cannot image enough. I get it. It would be such a treasure if we could finally find a biomarker, right? Because we have to do everything with clinical interviews, and it's exhausting, and it takes us further and further away from being a medical discipline. And we're doctors, so we'd love to just have a biomarker that says, yes, this is an actual disorder. It's not something that we have socially constructed. So we're doing a lot of neuroimaging and also reading a lot into it. But what they have not found is, because what you'll also hear is that from these imaging studies, that ADHD brains are different. We have found different morphologies in the brains of ADHD individuals than in normal brains. So neurotypical, and the research will use this language. They'll say compared to neurotypical individuals.
Yeah, which is like what? Who even defines that? Where's the
Sorry,
baseline?
you're breaking up. Can you still receive
Oh,
me?
yeah, yeah, I hear you. I don't think you're receiving me. Hopefully, Sophiso can
Okay.
clean this up. But what I was saying is like, what even is
It's just
neurotypical?
there's just a lag. It's just a
Yeah,
lag.
I blame the Swiss internet.
Nobody knows. Nobody knows. That's what. And that Ah, no. But so what they have found is that you have a volume d difference. So they found lower volume in the lateral prefrontal cortex of quote unquote ADHD individuals compared to neurotypical individuals. So people not diagnosed with ADHD. Fine. Very, very small. And they even had to admit that, oh, the differences are so small, we can't really, but there are differences. And so everyone just ran with it. There's an ADHD brain. And they'll say, oh, it's a neurodevelopmental disorder. So, it's okay, whatever. But what they have also found is that in brains of this, because they do personality studies, and they have found the same difference in people who are low in conscientiousness. And that just happens, that's the personality traits that maps completely with ADHD individuals, right? ADHD people are extroverted. They're low in conscientiousness. They're scattered, chaotic, creative. That's where the short attention spans. It maps perfectly onto this personality constellation. So what they need to prove, at least before I jump on this whole ADHD as an actual thing, is I want to see neuroimaging studies that will take the people who are undiagnosed, so people who simply have the same personality constellation, and I want to see a comparison. If I want to see from the these ADHD individuals that there's not. I want to see them compared in one study. You follow?
Yeah, yeah, yeah,
And
absolutely.
that
And
that research has not been done. That you
yeah,
can say that these are different from people with simply this personality.
yeah,
And they
I,
have
I
not been able to do that.
I'd never considered the personality angle before, um, right now, actually. And it keeps saying my internet connection is unstable, but whatever. It's a free podcast. You get what you pay for.
Yeah,
So, but
you're at fault. It
yeah,
tells me that it's your fault.
it's Northern Nevada internet. Yeah. But I know I have long had a theory that ADHD falls into one of two camps, sometimes both, but only two. And it's you're either ridiculously intelligent or you have a trauma history that causes you to act, weird because you don't trust the world, right? Sometimes both. So the ridiculously intelligent people, of course, have a tough time sitting still, focusing, concentrating because in their minds, they're mastering whatever the subject is very quickly. So if it's math class, they just, oh, I understand it. Now it's time to doodle or whatever, or flick pencils at my neighbor in school. If you got a trauma history, you're hypervigilant, so you're not going to settle down and pay attention. It's never not one of those two. And sometimes it's both, because sometimes really smart people can have trauma histories as well. But I never consider the personality domain. And I know I haven't watched the or listened to the podcast yet, but you had JD Haltigan on. And did you guys discuss this with him?
Oh no, not so much. We focused on cluster B. We focused on the ideological capture, but I would definitely want to have another conversation because it went on rather with the two of us. So
Yeah.
we didn't cover that yet. That would be interesting. Yeah.
Yeah, because he likes that stuff too, and he's also he's the one who's helped me change my mind because he changed his mind about genetic predispositions to things being expressed by the
Oh.
environments, less so than people who have only environmental influences warping or altering how their personalities manifests in especially into disordered personalities. And that was really fascinating to me. And I thought that really makes a difference when we're talking about people who are so impacted that they fall into the cluster B domain and they're causing harm to others with their narcissism, their borderline, their histrionic, their antisocial behaviors. Because how else could you have two kids from the same family present completely differently in adulthood, right? It's like, well, because the environment may have been similar,
Mhm.
they were both, not traumatized or they were traumatized or whatever, but there is a genetic predisposition to one or another, and depending on the environment, it may or may not come out. And I thought that was fascinating, which leads into my other question I want to ask you, which is about how has autism been hijacked by the narcissists? I know the answer, and I don't want to say it though. I want you to say it because you're the one who came up with this, and you're the one who wrote the article about it. Because this is another very big issue in our domain, because so many people now are hiding behind this. I'll put it in air quotes, apparent autism as an excuse for their bad behavior. And Josh covers this too, but you're the clinician, I'm a clinician. We can speak to this a little bit more robustly, I believe, and explain to the listening audience that just because somebody says I have autism or I have ADHD is not an excuse for lack of accountability. But I think that's exactly where we've trended in recent years, where we just go, it's just his fill in the blank diagnosis. His Sagittarius is acting up today, right? It's like, no, you still don't get to treat people with disrespect because you think you
Yeah.
have an autism disorder, which still is a disorder, by the way, in the book. It's not, it's something to be treated. Like
Yeah, yeah,
this is a
yeah,
disorder.
yeah, yeah, absolutely. Yeah, but we're not helping. And that was the point of my article was that you have all these actual autistic kids who are not getting the help they need because they are placed because of mainstreaming. They're placed in completely normal classrooms, and then they face the resentment of their peers when they can't control their behavior. And that's different than the sort of the undisciplined child who doesn't have a father at home or just because that's I've seen very few actually autistic children. It's very rare.
Vanishingly
They
rare.
estimated, yes, When it first came out, they estimated like 4, 5, and 10,000 when it was first diagnosed as
Yeah,
infantile
now they're saying it's
autism,
like
and then
one
it
in
just
32 or
expanded.
something.
Exactly, which would mean exactly one kid in every classroom. And so so they're suffering, and I think that it's been hijacked by narcissists because autism is now uh something to it's it's sort of the it's sort of the edgy, endearing, very intellectual person. It just means you're extra special. You're extra intelligent and you have extra special gifts, and we will allow you to be rude um, because we sort of think it's charming.
Yeah, or break convention
And
like, oh,
so,
I can only write
exact
in lowercase letters because my autism doesn't let me do capital letter. It's like, what? That's
like
not even a
that's the thing.
thing.
Yeah, like the truly autistic kids, they had trouble writing at all. And that's, that's my problem with these spectrum diagnoses. And we have a lot of them now. It's that, for diagnostic purposes, you shouldn't have categories where two patients look completely different. That defeats the purpose. We want to place people in categories. And I know that's controversial in itself to say. A lot of psychologists tell me we shouldn't have categories and we need categories because that's the only way we know how to apply correct treatment. That's what we want to
Yes,
do.
yes,
And
yes,
then
because
it
otherwise you don't
defeats
know
the
what to
purpose
do.
when two people have completely different manifestations of this same, then it can be whatever. And then we could also just go home. Like, what are we even doing anymore? And this is, and I see so many mothers who have these narcissistic traits and they don't even have to have a cluster B. So we are fostering a lot of narcissistic traits in people. That's what we're encouraging with this ever since we started with the self-esteem movements in the 90s, that we've been quietly fostering those narcissistic traits, the sacred self-expression. Authenticity is everything. But please tell me what the difference is between being authentic and being rude, and I'll give you money. And so these mothers, they want to have the autistic child because that means she gave birth to the extra special genius, and she's like she's understanding more than you do, and she gets status, she gets social cachet from having an autistic kid. It's not no longer the difficult child, the child who should have been taught better at home, but she's so that's a sleight of hand. So we've made a diagnosis that can so easily be preyed upon by narcissists. And the same can be said with ADHD.
Yeah. Well, and it didn't start in the 90s. I think it started in the early 80s with IALAC week. I don't know if you guys had that, but we had I am lovable and capable. It's an acronym called IALAC, and we wore little buttons when I was in
Oh
elementary
my
school.
God.
I am lovable and capable, IALAC week. And we spent a whole week praising ourselves for being awesome. So I think it started much earlier than that. But I also have a theory, and I want to bounce this off of you, and I want to be mindful of time too, that I think that a lot of this narcissistic presentation in culture that has been obscured by poor clinical acumen, it's accelerated by instant gratification. And I don't know when it started, probably from like the microwave oven or something. And it moved forward into the VCR when we could record our shows and then watch them later. And then it was, on demand, everything, 8 tracks to cassette tapes to CDs to MP3s to streaming, right?
Mhm.
Like now we don't have to wait for anything. We don't have to work for anything. It's just instantly delivered. And now it's, DoorDash and Amazon and, same day everything. What do you think of
Just
that as
rub
an
it in.
overlay?
Rub it in. We don't have overnight delivery, and we're very
Oh,
bitter about it.
but I thought I
So that's
thought
why
you
I say
guys
just
were
rub it in.
you guys had everything over there. I keep
Yeah,
hearing
no,
about how Europe is so
nope.
much better.
Yeah, with now with before mass immigration. What?
No, we're not allowed to talk about that either. And that
No, no, no,
definitely
sorry.
wasn't globally coordinated right around
No, no,
2021. That definitely didn't happen.
no,
We don't have data to back that up either. Uh, anyway,
not at all. Anyway, yes. So the you What was the question? Sorry.
What do you think about instant
Yeah.
gratification contributing to narcissistic
All
presentation in
right.
society?
Exactly. Yeah, but of course it makes absolute sense. Because this whole selfish aspect of narcissism, what even is that self? Is it now, or is it me in 10 years, or is it me in 10 years? Um, when I want to do something for me now, I buy my daughter a dress, right? Because I like to see her looking nice, and that reflects nicely on everyone, whatever. But
Sure.
what even is that self? And so the selfish of the whole narcissism concept, which is also disputed in the field, the concept of narcissism and how to diagnose it and what goes in it and what's the subtypes and all of that, it's quite controversial. We're not
Is it really?
completely
I haven't
sure, and
heard
a lot of
this.
people, yeah,
We just don't even
a
talk
lot of
about it over
people
here.
think
So,
no, 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 but no. This is in the U.S. This is with the DSM, and some believe it shouldn't be. They just look at narcissism as a concept of the dark tetrad, and so it's discussed in that context because it's so
oh well,
difficult to
okay. Yeah.
diagnose, and how what is the disorder of the narcissist, because
Well,
narcissism it
our
used to be
criteria suck.
studied.
That's why
They
our criteria
they
suck.
Yes, yes, and then later on came the whole vulnerable narcissist. Because have you ever seen a grandiose narcissist in the clinic? I sure
Almost never.
haven't. They don't come
Almost
in because
never.
no, and so
Unless they're dragged in by
narcissist
their
was
spouse.
studied as uh, yeah, correct, correct. But would a true narcissist have a spouse and go to the clinic for that spouse?
No, no, it's like when things really get prickly
Yeah,
and their self-image is threatened at the prospect of divorce or jail time or whatever it is, that they go, all right, fine, I'm going to do the dog and pony show. Then they come into the clinic and then they wrap the therapist around their finger, spin them around, and spit them out. And if they encounter somebody like you or me who actually confronts them on this in a sober, clear-eyed, but compassionate way, they have nowhere to go. So usually they end up firing themselves and then their marriage deteriorates anyway. That's usually what I see happening. But yeah, because the narcissist often says things like, "What's a therapist going to tell me?" Like, that I don't already know.
yeah. Yeah, but I honestly doubt that those men are even narcissists, right? Because what is the narcissist is high, it's very low in agreeableness. It's a very
Correct.
disagreeable person. Extroverted, that's the grandiosity, and the grandiose narcissist, they separated into grandiose and vulnerable, and he is very low in neuroticism. So that's why the chance of depression or anxiety in him is very low. And they used to be studied in boardrooms, not in the clinic.
Yes.
And then
Yes.
came the vulnerable narcissist, which I think is much more prevalent.
Oh,
And
oh
those
yeah.
are the ones we're speaking about, the women. And they're the ones who will come and say, I am autism and I am PTSD or CPTSD. And
CPTSD.
I
Oh
have it.
man.
I am the best at being a victim because of how special I am.
Yes. Yes. And that
That's
bleeds,
the
I think,
vulnerable
I would say
narcissist.
that actually edges into histrionic because it's a look at me, look at me, look at me, look at
Yeah.
me.
And then they have the TikTok, they have the Reels, and they
Yep.
have the audience that didn't used to be, and so that's magnifying it. So all those problems, and still we like to focus on the boardroom narcissist, which is just like, is like, are you? It's a lot of like there was so much talk about Steve Jobs, and that. I mean, if you want to go the talk about psychiatry, you have to talk about functioning. That's what is it a psychiatric disorder? Is there impaired psychosocial functioning? Yes or no? And that's why I say that it would completely disqualify them from having a disorder.
Correct.
Because like look at Elon Musk, who came out on stage and says, I like he came out of the closet as having Asperger's. So I'm like, you are arguably the most functional human in the world.
Yeah.
And you're supposed to have a psychiatric disorder?
Yeah, which
It
area of
puts
impairment
everything
are
in
you
doubt.
are you experiencing? Yeah. It's
Exactly.
supposed to impair something. Where are you impaired? Now, if you could make
Like,
an argument that
yeah,
says
and we've
if
come
you leave
away
a
from that.
yeah, I was
Yeah,
going to say
we
you
come
could
away from that because we don't like to talk about functioning. So we don't like to talk about because then you have to answer the question, what is functioning? And when everything is so postmodern, everything's relative, and what even is meaning? What even is functioning? And what even are, should we even have social norms? Well, then all the sand falls
yeah,
then the whole fortress of psychology, of psychiatry, psychology just will just wither away with the
it's
sand.
meaningless. Yeah,
It
because you have no
absolutely
anchor.
means unless we define those things. We have to talk about what we mean social functioning is. What does that mean in the West? That ties nicely back to what we started in the beginning. This is a modern Western problem because we no longer dare talk about what it means to be socially functioning in our society.
Right. And because that threatens the postmodern movement, which is that nothing is real, everything is a construct, it's all self-created. And so, therefore, if you have objective truth or objectivity at all, or not even to say nothing of agreed upon societal standards and norms, then postmodernism falls apart. Postmodernism's great as a thought experiment for the overly rigid thinker, right? The binary thinker who's suffering from anxiety, who only sees two options. You say, "Hey, let's tear some of this apart and introduce some gray to your black and white." That's cool as a
Yeah.
thought experiment, but if you live there, everything dissolves and nothing means anything. And then of course, we're going to have a sick society where all we're doing is mirroring off of each other's ailments and defining ourselves based on somebody else's opinion of us, which also, by the way, changes because everything's a construct. Of
Mhm.
course, we're going to erode reality. Of course, we're going to end up with more psychotic presentations in the form of delusions like, I was born in the wrong body. It's like, what does that even mean? What does that even mean? Like, that lacks all meaning and definition. Well, I think
Exactly.
we've solved,
Exactly.
at least we've solved the world's problems in this show.
Yes,
That's
I
nice.
hope I haven't managed to make you as disillusioned with our field as I am. I'm struggling with it very much,
I was
to
there
be
years
honest.
ago.
But
I
yeah,
was there years
but I
ago.
do
It's okay.
have people that I help, and in a very different way. Therapy has to be about being accountable for your actions and taking more responsibility and just doing more. Go out and do instead of sitting here and feeling.
Yeah, and I agree with that. I'm really pleased to have connected with you because it makes it seem like we're less alone, we're less isolated when it seems to be the entire field has been captured by this mind virus of postmodern deconstructionism.
Yeah.
When individuals like you and me and some of the other people we know and love across the interwebs are standing up against it, saying, no, this isn't right. And we can say it's not right based on the evidence that we see with our own eyes that people aren't getting healed. Society is empirically getting worse, right?
Yes.
Suicides aren't going down anywhere.
No.
Mental illness presentations aren't going down. Self-harm isn't going down, right? So we can't make a credible argument that what we're doing is working. So we have to go back to the roots of what it used to be, and that was anchored, principled interventions for the purpose of a goal achievement, right? And so I think
Yes.
eventually the pendulum will swing back to where it's supposed to be and away from this lunacy of just petting and stroking and affirming people in their own
Mm.
illnesses. That doesn't help. Why would you want to stay ill?
Yeah.
So
Yes.
thank
I
you.
agree. Thank
So where
you.
can people reach you? I know you have a Substack entitled Psychobabble. Where else can
Yes.
people reach you?
Come over to Psychobabble. That's the main hub. Or YouTube. Also Psychobabble with Spier on YouTube or Psychobabble with Spier on Substack. And join our community there. I've got a lot of fun content
Yes, you do.
coming as well. I'm doing a live session on September 28th if you want to join.
Oh,
That's
fun.
a Sunday. So go and check out. It's all on my Substack. So that I'm going to talk about therapy, red flags, green flags, and debunked concept that just won't die.
Yeah. Yeah. It can feel very bold when you speak truth and reality in a world that has taught us to invert all that stuff. Reality, like women need belonging, they need families,
Exactly.
men need leadership and things to do with their hands, right? Like it can seem very bold and unorthodox and iconoclastic, but really what we're doing is doing what humanity has done for 40,000 years. We just flipped it on its ear for the
Exactly.
last 50. So,
Yeah, that's why I chose this anti-feminist psychiatrist. But it's actually Janice Viermingo, and I thought, oh, that's a fun name, and it was an attempt to sort of break that dam to just sort of be because it's so controversial. It gives you such a reaction, and I just think that's what we need to do. We need to say things as spicy as we can
yeah,
to get the proper attention on it.
yeah. Well, thanks for making the time. Spier is
Thank you.
spelled Spier, by the way, and you can find
Exactly.
her where we said you can find her. I appreciate your time. I'll let you go back to your family. I know it's dark
Thank
there where
you.
you are, and you're about to have dinner, probably
Yeah,
already
dad.
had dinner, maybe.
The dad has put them to bed, and I'm awaited, and yeah, I come in
Well,
and I say "ta-da," and they
yeah,
say
give my
"woo."
thanks to him and them for being
I
patient
will.
with us. So, have a
Thank
wonderful
you, and I'll
evening.
speak to
Thank
you
you.
again.
Yeah, and on behalf of our Noggin Notes family and the Zephyr Wellness family, we wish you all great mental wellness. Bye bye.